Imagine waking up with a sudden sharp pain in your testicles. Pain so intense, it stops you in your tracks. It's not just discomfort, it's your body's alarm system screaming that something is wrong. Whether it's a dull ache, tenderness when touched, or stabbing pain that won't go away, testicular pain can be a terrifying experience. But what does it really mean? Is it an infection, an injury, or something far more serious like cancer or torsion? In this video, we uncover the hidden reasons behind testicular pain, the warning signs you must never ignore, and the urgent steps you should take before it's too late. Part 1. Understanding testicular pain, the basics. Testicular pain, also known as scrotal pain, is a condition that can affect males of all ages, from young boys to older men. It can occur in one or both testicles and may vary in intensity from a mild ache to severe discomfort. Sometimes the pain is sudden and sharp, while in other cases, it develops gradually and lingers for days or even weeks. The testicles are extremely sensitive organs. They are housed in the scrotum, a loose pouch of skin that hangs behind the penis. Because of their location and sensitivity, the testicles are vulnerable to injury, infection, inflammation, and other medical conditions. When there is something wrong in this area, the body responds with pain as a warning signal. Pain in the testicles can come from the testicles themselves or from surrounding structures like the epididymis, spermatic cord, or even organs in the lower abdomen. The key to treating testicular pain is understanding where the pain is coming from and what is causing it. Testicular pain is typically divided into two categories: acute and chronic. Acute testicular pain starts suddenly and is usually severe. It often indicates a serious condition such as testicular torsion or trauma and requires immediate medical attention. Chronic testicular pain, on the other hand, lasts for more than 3 months and is usually less severe. It can result from unresolved infections, nerve damage, or even psychological factors. Pain may also be localized or referred. Localized pain originates in the testicles or scrotum, while referred pain comes from another area of the body, such as the kidneys, lower back, or groin, and is felt in the testicles. Understanding the nature of the pain, its location, duration, and triggers is essential for proper diagnosis. Medical professionals will ask detailed questions and may perform a physical exam to check for swelling, lumps, tenderness, and other signs. In some cases, imaging tests like ultrasounds or urine tests are used to confirm the diagnosis. Some men may notice tenderness or pain only when the testicles are touched. This type of pain is often associated with conditions like epididymitis, orchitis, or varicocele, but it can also be due to minor trauma, skin irritation, or even anxiety. Even though many cases of testicular pain are not life-threatening, some are medical emergencies. Testicular torsion, for example, occurs when the spermatic cord twists and cuts off blood flow to the testicle. This condition can lead to permanent damage or even loss of the testicle if not treated within a few hours. Knowing the symptoms of such emergencies is crucial. In the next sections, we will explore the most common and most serious causes of testicular pain, including infections, injuries, structural problems, and rare conditions. We'll also cover the signs that require immediate medical care and the options available for treatment and prevention. If you've ever experienced testicular pain or worry about what it could mean, stay with us as we break down everything you need to know. Part 2. Causes of testicular pain: infections, injuries, and structural problems. Testicular pain is a complex symptom that can result from a wide range of underlying conditions. To understand why this pain occurs, it's essential to explore the specific causes in detail. From bacterial infections to twisted cords and hidden structural problems, the male reproductive system can be affected in numerous ways. Let's dive into the most common medical causes of testicular pain and how each condition presents itself. Epididymitis, inflammation that can't be ignored. One of the most frequent causes of testicular pain in adult men is epididymitis. The epididymis is a tightly coiled tube located behind each testicle. It stores and carries sperm and plays a crucial role in male fertility. When this structure becomes inflamed, usually due to an infection, it can cause intense pain and swelling in the testicle. Epididymitis is often caused by sexually transmitted infections, especially chlamydia and gonorrhea in younger men. In older men, it may result from urinary tract infections or prostate infections. The condition often starts with mild discomfort and progresses into significant pain if left untreated. Symptoms of epididymitis include pain and tenderness in one side of the scrotum, swelling and redness, fever and chills, a heavy or dragging sensation in the testicle, painful urination or an urgent need to urinate, discharge from the penis in sexually transmitted cases. Treatment typically involves antibiotics to fight the infection, rest, scrotal support, and anti-inflammatory medications. If not treated promptly, the infection can spread and damage the testicle, potentially leading to infertility. Orchitis, when the testicle itself is inflamed. While epididymitis affects the epididymis, orchitis refers to inflammation of the testicle itself. Orchitis may occur alongside epididymitis, epididymo-orchitis, or on its own. It's commonly caused by viral infections, most notably the mumps virus, especially in adolescent boys and young men who were not vaccinated. Symptoms include sudden onset of testicular pain and swelling, fever and malaise, nausea and vomiting, enlarged lymph nodes in the groin. Mumps-related orchitis can lead to testicular atrophy, shrinking of the testicle, and, in rare cases, infertility. Treatment focuses on relieving symptoms with bed rest, ice packs, pain relievers, and scrotal elevation. In bacterial cases, antibiotics are necessary. Testicular torsion, a surgical emergency. Perhaps the most urgent cause of testicular pain is testicular torsion. This occurs when the spermatic cord, which contains blood vessels, nerves, and the vas deferens, twists around itself. This twisting cuts off the blood flow to the testicle, leading to severe sudden pain. Testicular torsion is a medical emergency that typically affects teenagers, but can occur at any age. If not treated within 6 hours, the testicle may suffer permanent damage and might need to be surgically removed. Symptoms of testicular torsion include sudden, severe pain in one testicle, swelling of the scrotum, abdominal pain or nausea, a high-riding testicle, pain that worsens when standing or moving. Immediate surgery is required to untwist the cord and restore blood flow. Delay in treatment can result in the loss of the testicle and impaired fertility. Trauma. The impact of injuries to the testicles are surprisingly common, especially during contact sports, cycling, or accidental impact. While most injuries are minor and cause temporary pain, some can lead to more serious complications like testicular rupture or hematocele, collection of blood. Signs of serious testicular trauma include severe pain and swelling, bruising and discoloration, nausea or vomiting, difficulty walking or standing. Minor injuries are treated with ice packs, rest, and supportive underwear. Severe trauma may require surgical intervention to repair damaged tissue or stop internal bleeding. Varicocele, swollen veins causing discomfort. A varicocele is an enlargement of the veins within the scrotum, similar to varicose veins in the legs. It most often affects the left testicle due to anatomical differences in the blood supply. While varicoceles are often painless, some men experience a dull ache or heaviness, particularly after standing for long periods or exercising. Varicoceles can also impact fertility by affecting sperm production and quality. Diagnosis is typically made through physical examination or scrotal ultrasound. Treatment may include observation if asymptomatic, scrotal support and pain management, surgery or embolization for severe cases or fertility concerns. Hydrocele, fluid buildup in the scrotum. A hydrocele is a fluid-filled sac surrounding a testicle that causes swelling in the scrotum. It's usually painless, but can cause a sense of heaviness or discomfort, especially as the size increases. Hydroceles can develop from injury, infection, or inflammation. In newborns, they often resolve on their own. In adults, persistent hydroceles may require surgical drainage or removal. Hydrocele symptoms include swelling in one or both testicles, a feeling of heaviness, possible discomfort with movement. Hernias, when the intestine pushes down. An inguinal hernia occurs when part of the intestine pushes through a weak spot in the abdominal wall into the groin or scrotum. This can cause swelling, pain, and a visible bulge that worsens when coughing or lifting. Sometimes a hernia can become strangulated, cutting off blood flow to the trapped intestine. This is a medical emergency. Symptoms of a hernia include bulge in the groin or scrotum, pain or pressure in the groin, heaviness in the scrotum, nausea and vomiting if strangulated. Hernias are treated surgically, especially if they cause pain or complications. Spermatocele, cysts that form on the epididymis. A spermatocele is a benign cyst that forms in the epididymis and is filled with sperm-containing fluid. While usually painless, larger spermatoceles may cause discomfort, pressure, or a sense of fullness in the testicle. Diagnosis is done via ultrasound, and treatment is not typically required unless the cyst becomes large or painful. In such cases, surgical removal may be considered. Testicular cancer, rare but serious. Though rare, testicular cancer is a possible cause of testicular discomfort or pain. It most commonly affects younger men between the ages of 15 and 35. Often, testicular cancer presents as a painless lump, but some men experience aching or a sense of heaviness in the testicle or scrotum. Warning signs of testicular cancer include a lump or swelling in the testicle, a feeling of heaviness in the scrotum, a dull ache in the lower abdomen or groin, fluid buildup in the scrotum, tenderness or changes in breast tissue due to hormone secretion. Testicular cancer is one of the most treatable forms of cancer when caught early. Self-examination and prompt evaluation of any changes are critical. Chronic testicular pain. When it won't go away. Chronic testicular pain, lasting more than 3 months, may not always have a clear cause. Known as chronic orchialgia, this condition can be frustrating for patients and physicians alike. Possible causes include previous infections or surgeries, nerve damage or irritation, referred pain from the back or pelvis, psychosomatic or stress-related issues. Diagnosis involves ruling out all other causes. Treatment options range from medications and nerve blocks to physical therapy and even surgical procedures like spermatic cord denervation in severe cases. Referred pain, signals from elsewhere. Sometimes, testicular pain doesn't originate in the testicles themselves. Instead, it may be referred from other areas of the body. Common sources of referred pain include kidney stones, which can radiate pain down to the groin, lower back injuries, which may affect nerves leading to the scrotum, inguinal nerve entrapment, common after surgery or injury. Understanding the source of referred pain requires careful diagnostic evaluation, including imaging and nerve studies when needed. In this part, we explored the wide range of medical conditions that can lead to testicular pain. From treatable infections to urgent emergencies and chronic unexplained discomfort, each cause demands a specific approach. In the next segment, we'll dive deeper into how testicular pain is diagnosed, what tests are used by doctors, and how you can recognize the difference between a mild issue and a life-threatening condition. Stay with us as we continue unraveling the mystery of testicular pain, one step at a time. Part 3. Diagnosis and evaluation of testicular pain, finding the root cause. Diagnosing testicular pain is a critical step in identifying the underlying condition and determining the right course of treatment. Because the causes of testicular pain are so varied, ranging from mild infections to surgical emergencies, healthcare professionals must take a thorough and methodical approach to evaluation. In this part, we will break down how doctors assess testicular pain, the tests and procedures involved, and how to distinguish between minor and serious conditions. Initial evaluation, medical history, and symptoms. The diagnostic journey begins with a detailed medical history. The doctor will ask specific questions to help narrow down possible causes. When did the pain start? Is the pain constant or does it come and go? Is it sharp, dull, aching, or burning? Does anything make the pain worse, such as movement or touch? Is the pain localized to one testicle or both? Have there been any recent injuries, infections, or sexual activity? In addition, a history of previous testicular issues, surgeries, or family history of testicular cancer can provide important clues. The doctor will also ask about associated symptoms, such as fever and chills, nausea or vomiting, swelling or redness of the scrotum, painful urination or urinary urgency, penile discharge, abdominal or lower back pain, presence of lumps or changes in testicle size. This history helps distinguish between conditions like infections, torsion, trauma, hernias, or cancer. Physical examination, a hands-on approach. The next step is a physical examination. This involves careful inspection and palpation of the testicles, scrotum, and surrounding areas. The doctor will check for tenderness and location of pain, swelling, warmth or redness, lumps or masses, changes in testicle size, shape, or position, fluid buildup in the scrotum, the position of the spermatic cord and epididymis. A cremasteric reflex test may be performed. In a healthy male, lightly stroking the inner thigh causes the testicle on that side to rise. Absence of this reflex may indicate testicular torsion. The doctor will also examine the abdomen and groin for signs of inguinal hernias, lymph node enlargement, or kidney-related issues. Scrotal ultrasound, the gold standard. One of the most important diagnostic tools for testicular pain is the scrotal ultrasound. This non-invasive imaging test uses high-frequency sound waves to create detailed images of the testicles, epididymis, and blood vessels in the scrotum. A Doppler ultrasound adds another layer by showing blood flow to the testicles. This is especially important in diagnosing testicular torsion, which shows reduced or absent blood flow on the affected side. Ultrasound can also identify epididymitis and orchitis, hydrocele or varicocele, testicular tumors, spermatocele or cysts, hematocele, blood collection from trauma, testicular rupture. The test is quick, painless, and can often provide immediate answers to the source of pain. Urine and blood tests. Identifying infections and inflammation. Urinalysis is often ordered to detect signs of a urinary tract infection, sexually transmitted infection, or inflammation. If infection is suspected, a urine culture may be performed to identify the specific bacteria and determine the best antibiotic treatment. In cases of suspected sexually transmitted infections, additional tests like nucleic acid amplification test and for chlamydia and gonorrhea, blood tests for syphilis or HIV, swab from the urethra if discharge is present. Blood tests may be used to evaluate systemic infection or inflammation. Elevated white blood cell counts, WBC, indicate infection. C-reactive protein, CRP, or erythrocyte sedimentation rate, ESR, may help assess the severity of inflammation. In the case of a suspected testicular tumor, tumor markers such as AFP, alpha-fetoprotein, beta-HCG, and LDH are tested in the blood. Imaging beyond the scrotum, looking deeper. If referred pain or abdominal causes are suspected, further imaging may be required. These might include abdominal ultrasound to check for kidney stones or hernias, CT scan to detect retroperitoneal masses or abscesses, MRI for more detailed images of soft tissues and nerves. These tests are not always necessary, but are considered when the cause of pain is not found through initial tests. When the diagnosis is unclear, sometimes, despite thorough testing, the cause of testicular pain remains elusive. This is particularly true for cases of chronic orchialgia or long-term testicular pain without an identifiable cause. In such cases, additional diagnostic options may include nerve conduction studies to look for neuropathic pain, trial of nerve blocks to assess if pain relief is possible, exploratory surgery if torsion or tumor is still suspected but not confirmed by imaging. These methods are used selectively and often involve specialists such as urologists or pain management experts. Emergency versus non-emergency pain. Knowing the difference. Understanding when testicular pain is an emergency can be life-saving. Testicular torsion, strangulated hernia, and testicular rupture are all urgent conditions. Warning signs that require immediate medical attention include sudden, severe pain in one testicle, swelling and redness of the scrotum, nausea and vomiting with scrotal pain, testicle positioned higher than normal, loss of cremasteric reflex. If these symptoms are present, do not wait. Go to the emergency room immediately. Delayed treatment can result in permanent damage or loss of the testicle. On the other hand, gradual pain that develops over time, especially with fever, urinary symptoms, or discharge, may suggest an infection like epididymitis or orchitis. While still requiring prompt care, these conditions are usually not surgical emergencies. Role of self-examination. Catching problems. Early regular testicular self-exams are a critical part of men's health. Men should examine their testicles monthly, ideally after a warm shower when the scrotal skin is relaxed. Steps include 1. Use both hands to examine each testicle. 2. Roll it gently between your fingers. 3. Feel for lumps, swelling, or changes in size or consistency. 4. Check for discomfort or pain during examination. While not every lump or irregularity is cancerous, anything unusual should be evaluated by a doctor. Early detection leads to better outcomes. Psychological and neurological considerations. In some cases, especially when no physical cause can be found, the pain may have a psychological or neurological origin. Stress, anxiety, or depression can contribute to heightened sensitivity and chronic pain. In other cases, nerve injury from past surgeries, such as hernia repair, may lead to neuropathic pain in the scrotal region. Signs of neuropathic or psychological testicular pain include burning or tingling sensation, pain that spreads from the groin or lower back, pain triggered by light touch or pressure, pain without swelling or visible signs. Management may involve medications like gabapentin or amitriptyline, counseling, physical therapy, or referral to a pain specialist. In this part, we've explored how doctors diagnose testicular pain, from the initial questions to sophisticated imaging and laboratory tests. Understanding the diagnostic process can help demystify what happens during a medical evaluation and reinforce the importance of early intervention. In part 4, we'll move into treatment strategies, how testicular pain is managed depending on the cause, what medications or surgeries may be involved, and what recovery looks like. Whether the pain is due to an infection, trauma, or more serious disease, there are solutions that can bring lasting relief. Stay tuned. Part 4. Treatment and management of testicular pain, from relief to recovery. Once the cause of testicular pain has been identified through careful diagnosis, the next step is treatment. Because the causes of testicular pain are so varied, ranging from infections and injuries to torsion and tumors, the approach to treatment must be specific and targeted. Some conditions respond well to medication, while others require surgery or long-term management. In this section, we explore the full range of treatment strategies used to relieve testicular pain and restore health. Treating infections: antibiotics, rest, and support. For infections such as epididymitis and orchitis, treatment focuses on eliminating the infection and relieving symptoms. Most infections are caused by bacteria, and antibiotics are the cornerstone of treatment. For sexually transmitted infections, STIs like chlamydia and gonorrhea, the typical treatment includes doxycycline for 10 to 14 days, a single dose of ceftriaxone injected into the muscle. For non-sexually transmitted causes, such as urinary tract infections in older men, options may include ciprofloxacin, levofloxacin, trimethoprim sulfamethoxazole. In addition to antibiotics, supportive care is vital. Scrotal elevation using supportive underwear or towels. Cold packs to reduce swelling and inflammation. NSAIDs like ibuprofen or naproxen to relieve pain. Bed rest to reduce strain and promote healing. Most men begin to feel improvement within a few days, but completing the full course of antibiotics is essential to prevent recurrence. Managing viral orchitis. Symptom control. When orchitis is caused by a virus, particularly the mumps virus, antibiotics are not effective. Treatment focuses on symptom relief, pain relievers, acetaminophen or NSAIDs, ice packs to the scrotum, scrotal support, adequate hydration, bed rest. It may take 1 to 2 weeks for symptoms to fully resolve. In rare cases, viral orchitis can lead to testicular atrophy or infertility, so follow-up with a healthcare provider is important if swelling persists. Testicular torsion, emergency surgery. Testicular torsion is one of the few true urological emergencies. Immediate surgical intervention is required to untwist the spermatic cord and restore blood flow. If treated within 6 hours, the testicle can usually be saved. Beyond 12 hours, the chances of saving the testicle drop significantly. Surgery is called detorsion and orchiopexy, where both testicles are stitched to the scrotum to prevent future twisting. If the testicle is no longer viable, orchiectomy, removal of the testicle, may be necessary. While removal of one testicle does not usually affect fertility, it can be emotionally difficult, and counseling may be helpful. Trauma and injury, immediate and long-term care. Minor testicular injuries usually respond well to conservative treatment. Ice packs, applied in 20-minute intervals, rest and limited physical activity, supportive underwear to minimize movement, pain relief with NSAIDs. However, severe trauma may result in testicular rupture, hematocele, or contusion. In such cases, emergency surgery may be needed to repair torn tissue, remove blood clots, preserve testicular function. Recovery from surgery depends on the extent of the injury. Most patients heal fully with proper care and follow-up. Varicocele, when swollen veins need attention. Varicoceles are often managed conservatively if symptoms are mild or there are no fertility concerns. Management includes wearing supportive underwear, limiting heavy lifting or prolonged standing, NSAIDs for pain control. When symptoms are severe or infertility is a concern, surgical treatment may be recommended. Varicocelectomy, ligation of swollen veins through a small incision. Percutaneous embolization, a less invasive option where a catheter is used to block off blood flow to the varicocele. Both approaches are effective and recovery is typically quick. Hydrocele and spermatocele, treating cysts and fluid buildup. For hydroceles that cause significant discomfort or do not resolve on their own, surgical treatment may include hydrocelectomy, removal of the fluid sac, needle aspiration. In some cases, fluid can be drawn out, though it may reaccumulate. For spermatoceles, surgery is only recommended if they cause pain or grow large. The procedure is called spermatocelectomy, which removes the cyst while preserving surrounding structures. Most men recover well with minimal complications. Inguinal hernia, repairing the root problem. Inguinal hernias that extend into the scrotum can cause testicular pain. Treatment is surgical. Open hernia repair, a traditional method using mesh reinforcement. Laparoscopic repair, a minimally invasive technique using small incisions and a camera. If a hernia becomes strangulated, emergency surgery is required to prevent damage to trapped organs. Recovery from hernia surgery is generally quick, though lifting and intense activity are restricted for several weeks. Testicular cancer, multidisciplinary management. Testicular cancer is treated based on the type of cancer and stage of disease. Treatment may include 1. Surgical removal of the testicle, orchiectomy, almost always the first step. 2. Radiation therapy, used for certain types like seminomas. 3. Chemotherapy, for more advanced or aggressive cancers. After surgery, many men retain full sexual function and fertility, though sperm banking may be recommended beforehand. Regular follow-up with blood tests, imaging, and physical exams is essential to monitor for recurrence. Psychological support and counseling are important aspects of cancer recovery, especially for young men coping with body image and fertility issues. Chronic testicular pain, addressing long-term discomfort. When testicular pain persists for 3 months or more, it's classified as chronic orchialgia. Treatment depends on the underlying cause, but options include pain relievers and anti-inflammatory drugs, neuropathic pain medications, such as gabapentin or amitriptyline, nerve blocks to identify and treat pain from nerve irritation, pelvic floor physical therapy, cognitive behavioral therapy, CBT, if psychological factors are present. If all conservative methods fail, surgical options may be considered. Microsurgical denervation of the spermatic cord disconnects the nerves carrying pain signals. Epidydymectomy or orchiectomy in extreme cases when all else fails. These procedures are considered last resort options and only after careful evaluation. Holistic and supportive care. The bigger picture recovery from testicular pain isn't just about treating the physical condition. It often involves emotional support. Fear of cancer, sexual dysfunction, or infertility can cause significant anxiety. Education. Helping patients understand their condition reduces fear and empowers them to take action. Partner involvement, especially for sexually transmitted infections or fertility concerns. Lifestyle modifications, avoiding activities that worsen pain, maintaining hygiene, and managing stress. Prevention, protecting your health. While not all causes of testicular pain are preventable, some simple steps can reduce the risk. Wear protective gear during sports or physical activity. Practice safe sex to prevent sexually transmitted infections. Stay up to date with vaccinations, especially the mumps vaccine. Perform regular self-exams to detect lumps or changes early. Seek prompt medical attention for any unexplained pain or swelling. In this part, we've covered the diverse and often highly effective treatments available for testicular pain. Whether it's antibiotics for infection, surgery for torsion or hernias, or long-term care for chronic discomfort, modern medicine offers hope for relief and recovery. In Part 5, we'll explore how testicular pain affects fertility, emotional well-being, and the quality of life. We'll also look at the long-term outlook for men who have experienced testicular conditions and what steps they can take to stay healthy for the future. Part 5. Testicular pain, fertility, and long-term impact. What every man should know. While testicular pain is often temporary, its effects can extend far beyond physical discomfort. In some cases, the pain signals deeper issues that may affect a man's reproductive health, hormonal balance, emotional well-being, and overall quality of life. In this section, we'll explore how testicular conditions can impact fertility, how to cope with psychological stress, and what the long-term outlook looks like for men who experience testicular pain. Fertility and the testicles, a vital connection. The testicles have two primary functions. 1, producing sperm for reproduction. 2, producing testosterone for male sexual development and health. When a man experiences pain in this area, it can indicate damage or disruption to these essential functions. Depending on the cause of the pain, fertility may or may not be affected. Conditions that can affect fertility. 1, epididymitis and orchitis. Infections like epididymitis or orchitis, especially if untreated or recurrent, can damage the delicate sperm-carrying structures or cause scarring of the epididymis and vas deferens. This may lead to reduced sperm count, poor sperm motility, blockage of sperm flow. 2, testicular torsion. If testicular torsion is treated early, the testicle may recover fully. However, delayed treatment can result in permanent testicular damage or atrophy, decreased sperm production, loss of the testicle, requiring removal, orchiectomy. 3, varicocele. A varicocele can impair sperm production and quality due to increased heat and poor blood flow. Studies show that up to 40% of men with infertility have a varicocele. Surgery can improve sperm quality in many cases. 4, mumps orchitis. This viral condition can damage both testicles, particularly in postpubertal males. Bilateral orchitis can severely impair fertility and in rare cases lead to azoospermia, complete absence of sperm. 5, testicular cancer. Cancer itself may not always affect fertility directly, but treatment, especially chemotherapy and radiation, can impair sperm production. Surgical removal of a testicle also reduces sperm output by half. Preserving fertility. What can be done? If there is a risk to fertility, men have several options. Sperm banking before surgery or cancer treatment. Fertility evaluation through semen analysis and hormone tests. Medical therapy to address hormonal imbalances. Microsurgical procedures to remove blockages or repair structures. Assisted reproductive technologies, ART, such as IVF and ICSI. Men experiencing persistent testicular pain or diagnosed with a related condition should consult a urologist or fertility specialist to assess their reproductive health. Testosterone and hormonal health. The testicles are also the primary producers of testosterone, the male sex hormone responsible for libido and sexual function, muscle mass and bone density, mood regulation, energy levels. When testicular tissue is damaged due to trauma, torsion, cancer, or infection, testosterone production may decrease. This condition is known as hypogonadism. Signs of low testosterone include fatigue and low energy, reduced sex drive, erectile dysfunction, loss of muscle mass, mood swings, or depression. Diagnosis is made via blood tests measuring testosterone levels, typically in the morning. If confirmed, testosterone replacement therapy, TRT, may be recommended under medical supervision. Emotional and psychological effects. Testicular pain and its consequences can take a heavy emotional toll on men. The pain itself can lead to chronic stress, anxiety, sleep disturbances, and irritability. But beyond physical symptoms, there are deeper concerns. Fear of infertility or sexual dysfunction, embarrassment about discussing the issue, body image issues after orchiectomy or visible swelling, strained relationships due to pain or reduced intimacy. Men may hesitate to seek help out of shame or fear of a cancer diagnosis. This can delay treatment and worsen outcomes. Psychological support is essential, especially in cases of chronic testicular pain without clear cause, cancer diagnosis or treatment, loss of a testicle, ongoing fertility treatment. Cognitive behavioral therapy, CBT, support groups, and individual counseling can help men process these challenges and regain confidence. Sexual health and intimacy. Sexual health can be affected both physically and psychologically. Pain during or after ejaculation, reduced desire, or difficulty achieving erection can all result from testicular conditions. These issues may stem from physical damage to nerves or tissue, inflammation of reproductive structures, fear of worsening the pain, performance anxiety or depression. Open communication with partners and healthcare providers is crucial. Many issues can be improved with medication, such as PDE5 inhibitors for erectile dysfunction, counseling or sex therapy, pain management strategies, addressing underlying causes of pain or dysfunction, living with one testicle, what to expect. Men who undergo orchiectomy, removal of a testicle due to torsion, trauma, or cancer, often worry about their health and appearance. The good news is, one healthy testicle can produce enough testosterone and sperm for normal function. Fertility may be slightly reduced, but not eliminated. Testicular implants are available for cosmetic purposes. Regular follow-ups with a doctor, hormone testing, and sperm analysis can help ensure everything remains within healthy ranges. Long-term monitoring and follow-up. Even after treatment, some men require long-term follow-up to monitor for complications or recurrence of the original condition. Follow-up may include ultrasounds for men with history of varicocele, hydrocele, or chronic pain, tumor marker tests and imaging for testicular cancer survivors, semen analysis in men with fertility concerns, hormone testing if testosterone symptoms arise. For men who have undergone surgery, especially for torsion or hernia repair, periodic evaluation is recommended to ensure there's no testicular atrophy or long-term pain. Lifestyle and preventive care. Maintaining overall health can help protect against testicular problems and support recovery. Recommendations include exercise regularly, but avoid trauma-prone sports without protection. Maintain hygiene to prevent infections. Wear support underwear during physical activity. Avoid high heat environments like hot tubs, which may affect sperm production. Don't ignore testicular changes. Lumps, swelling, or persistent discomfort should always be checked. For sexually active men, use just protection to avoid sexually transmitted infections. Get regular screenings if at risk. Educate partners about symptoms and encourage shared responsibility. Educating young men and parents. Testicular health is often overlooked in youth health education. However, teaching young men to understand their bodies, recognize warning signs, and feel comfortable seeking help can save lives, especially when it comes to testicular torsion or early cancer detection. Parents should be aware of common symptoms in boys and teenagers, the importance of timely medical care for groin or abdominal pain, encouraging sons to report discomfort or changes without fear or shame. Key takeaways for long-term testicular health. Most causes of testicular pain are treatable, and full recovery is possible with early intervention. Fertility may be affected in some cases, but many men go on to father children with proper care. Testosterone production can be preserved or restored with monitoring and therapy. Emotional support and counseling are crucial, especially for chronic pain or post-surgery recovery. Regular self-exams and doctor visits are the best tools for early detection of serious issues. In this section, we've looked at how testicular pain can affect more than just the body. It touches every aspect of a man's health. But with proper care, open dialogue, and awareness, testicular pain does not have to define your life. Part 6. Preventing Testicular Pain, a complete guide to self-care and protection. Testicular pain, whether sudden or chronic, can often be prevented or at least reduced in frequency and severity through simple, consistent self-care practices and lifestyle adjustments. While not all causes of testicular pain are avoidable, many are related to infections, injuries, or delayed medical care that could be minimized with better awareness. In this section, we'll explore how to protect your testicular health through preventive habits, regular checkups, hygiene, and smart lifestyle choices. Understanding prevention, why it matters. Prevention isn't just about avoiding pain. It's about preserving fertility, hormonal balance, and quality of life. By focusing on testicular wellness, men can reduce the risk of infections and chronic conditions, detect dangerous issues like testicular cancer early, maintain optimal sexual and reproductive function, prevent long-term complications like infertility or hypogonadism. Testicular self-care is simple, private, and powerful. It starts with basic habits and the willingness to pay attention to changes in the body. Hashtag 1. Practice testicular self-examination, TSE. Monthly. One of the most important steps in testicular health is self-examination. This helps detect problems early, especially testicular cancer, which is most treatable when caught at an early stage. How to do it. Timing. Perform the exam once a month, ideally after a warm shower when the scrotal skin is relaxed. Position. Stand in front of a mirror and gently examine one testicle at a time using both hands. Technique. Roll the testicle gently between your thumb and fingers. Feel for lumps, swelling, or changes in size or consistency. Examine the epididymis at the back. It should feel soft and rope-like, not painful or swollen. Check for pain or tenderness. What to look for? Any lump or firm area, changes in size, shape, or texture, dull aches or heaviness, sudden pain or swelling. If you notice anything unusual, don't panic, but do contact a healthcare provider for evaluation. Hashtag 2. Protect against injury. Trauma is a common cause of testicular pain, especially in active men. Whether from sports, accidents, or heavy lifting, testicular injuries can lead to lasting pain and complications if not prevented. How to prevent testicular injury. Wear protective gear during contact sports like football, martial arts, or cycling. An athletic cup or jockstrap is essential. Be cautious when lifting heavy objects. Use proper technique to avoid straining the groin or lower abdomen. Avoid risky behaviors like skateboarding or motorbiking without protection. Exercise awareness during physical intimacy to avoid unintended impact or strain. Even with precautions, if injury occurs and results in swelling, bruising, or severe pain, seek medical evaluation immediately. 3. Practice safe sex. Many cases of epididymitis, orchitis, and urethritis stem from sexually transmitted infections, STIs. Practicing safe sex not only protects against STIs, but also reduces the risk of chronic testicular pain caused by infections. Protect yourself by using condoms consistently and correctly during sexual activity, limiting the number of sexual partners, getting regular STI screenings, especially if sexually active with multiple partners, discussing STI status openly with partners, completing antibiotic courses if diagnosed with an infection to prevent complications. Men under 35 are especially at risk for chlamydia and gonorrhea-related epididymitis. Prevention starts with education and responsibility. Maintain good hygiene. Personal hygiene plays a key role in preventing infections that can lead to scrotal and testicular pain. Daily hygiene tips. Wash the genital area thoroughly with warm water and gentle soap. Dry the area completely, especially between skin folds. Wear clean underwear daily. Choose breathable fabrics like cotton to reduce moisture buildup. Avoid tight-fitting clothing that can cause irritation or reduce airflow. Also, avoid using heavily scented or harsh soaps on the genital area, which can lead to irritation or imbalance of skin bacteria. Hammer 5. Get vaccinated. One of the major preventable causes of testicular pain is mumps orchitis, a complication of the mumps virus that can lead to testicular swelling and infertility. Prevent it with the MMR vaccine, measles, mumps, rubella, given in childhood, but check with your doctor if you're unsure of your vaccination status. Young adults and college students are at higher risk during outbreaks. Immunization significantly reduces the chance of developing viral orchitis. Vaccination is a simple yet powerful tool in testicular health protection. 6. Avoid excessive heat exposure. Prolonged heat exposure can affect sperm production and lead to discomfort in the testicles. While heat alone may not cause pain, it can aggravate underlying conditions like varicoceles or hydroceles. Minimize heat exposure by Avoiding hot tubs and saunas for long durations, not placing laptops directly on the lap for extended periods, wearing loose-fitting underwear and breathable pants, keeping the environment cool during sleep and exercise. If trying to conceive, taking heat exposure seriously is especially important. Manage physical activity and lifting. Repetitive strain or heavy lifting can cause inguinal hernias, a major cause of groin and testicular pain. Reduce your risk. Use proper lifting techniques. Bend the knees, not the back. Avoid lifting objects that are too heavy. Strengthen core muscles to support the lower abdomen. Take frequent breaks during physical work. Don't ignore groin or lower abdominal pain. It may signal the beginning of a hernia. Seek medical attention if you notice a bulge or pressure in the groin area, especially if it worsens with activity. 8. Attend regular health checkups. Many men avoid or delay going to the doctor for genital or urological issues due to embarrassment, but routine checkups are essential for early detection and long-term prevention. During checkups, your doctor can perform a testicular exam, check for varicoceles, hydroceles, or hernias, review any past injuries or infections, provide guidance on fertility, testosterone, or sexual health. Screen for testicular cancer risk factors. Men with a family history of testicular cancer or urological conditions should discuss more frequent screenings with their healthcare provider. Measure 9. Stay active and manage stress. Physical and mental health are deeply connected to testicular wellness. A sedentary lifestyle, poor diet, or chronic stress can weaken the immune system, reduce testosterone levels, and contribute to chronic pain. What helps? Exercise regularly to maintain circulation and hormone balance. Eat a balanced diet, rich in antioxidants and healthy fats. Avoid smoking and excessive alcohol, which can harm reproductive health. Manage stress through mindfulness, deep breathing, or therapy. Get adequate sleep, which is essential for testosterone production. Remember, caring for your testicular health is caring for your overall health. Educate yourself and others. Knowledge is one of the strongest tools of prevention. Whether you're a young man, a parent, a coach, or a partner, understanding testicular health allows you to recognize danger signs and support others who may be suffering silently. Key facts to know. Testicular cancer is most common in men aged 15 to 35, but highly curable if caught early. Pain that comes on suddenly, especially with swelling or nausea, may be torsion and requires emergency care. Most testicular conditions are treatable and do not mean need a fertility or sexual function. Speaking openly about pain and getting help early is never a sign of weakness. It's a sign of strength. Final thoughts on prevention. Testicular pain can be a source of fear, confusion, and discomfort, but it doesn't have to be. With a few simple habits, consistent awareness, and early action, most causes of testicular pain can be prevented or resolved before they become serious. By practicing self-care, staying informed, and taking your body's signals seriously, you not only protect your reproductive and hormonal health, you take control of your future. Part 7. Frequently asked questions and myths about testicular pain. What men really want to know. Testicular pain can cause anxiety, confusion, and silence, especially when men are unsure whether their symptoms are serious or just temporary. Myths and misinformation often prevent people from seeking help at the right time. In this final part, we'll answer some of the most common questions about testicular pain, clear up dangerous myths, and offer expert-backed advice so you can make informed decisions about your health. 1. Is it normal to have testicular pain sometimes? Occasional mild discomfort, especially after physical activity or prolonged sitting, can be normal. However, persistent, severe, or recurring pain is not, and should always be evaluated by a doctor. Even if the pain disappears on its own, it could indicate an underlying issue like a hernia, infection, or nerve irritation. When to worry? Pain that wakes you up at night, pain that comes on suddenly and sharply, swelling, redness, or warmth in the scrotum, nausea or vomiting with testicular pain, pain lasting more than a few days. 2. Can testicular pain come from other parts of the body? Yes. This is known as referred pain. Because the nerves of the testicles are connected to the abdomen, groin, and spine, pain in these areas can sometimes be felt in the testicles. Causes include kidney stones, herniated discs in the lower back, inguinal hernias, prostatitis, muscle strain. If testicular pain seems to radiate from your lower back, groin, or abdomen, it's important to consider other causes beyond the testicles themselves. 3. Can stress or anxiety cause testicular pain? Yes. Stress and anxiety can cause muscle tension, increased sensitivity to pain, and worsen perception of minor discomfort. Additionally, chronic stress may increase pelvic floor muscle tightness, leading to referred pain in the scrotum or testicles. While the pain is real, the source may be psychosomatic. In such cases, techniques like cognitive behavioral therapy, CBT, breathing exercises, pelvic floor physical therapy, anti-anxiety medications can help relieve symptoms. Scenario 4. Does testicular pain always mean cancer? No, in fact, testicular cancer is rarely painful in its early stages. Most men discover it as a painless lump, change in testicle size, or firmness. Pain is more common when the tumor grows large or bleeds internally. That said, any new lump, hardness, or swelling should be evaluated immediately. Early-stage testicular cancer has a very high cure rate when caught early. 5. Can sitting for long periods cause testicular pain? Yes, long periods of sitting, especially on hard surfaces or with tight clothing, can put pressure on the perineum and scrotal nerves, causing discomfort. It can also lead to reduced blood flow, nerve irritation, varicocele aggravation. Tips to prevent pain from sitting. Take breaks every 30 to 60 minutes. Use a cushioned seat or ergonomic chair. Wear loose, supportive underwear. Avoid placing laptops directly on the lap. 6. Can masturbation or sexual activity cause testicular pain? It's uncommon but possible. Pain after ejaculation can be caused by epididymitis or infection, congestion of seminal fluid, called prostatitis, overstimulation, or a rough activity. If the pain is frequent, worsens with ejaculation, or is accompanied by swelling or discharge, see a urologist. Nashar 7. Can a testicle twist on its own while sleeping? Yes. Testicular torsion can happen during sleep, particularly in adolescents and young men with a condition called bell clapper deformity, which allows the testicle to move freely. This is why sudden nighttime testicular pain is a medical emergency. If you wake up with severe pain, swelling, or nausea, go to the emergency room immediately. Delay can result in permanent damage. And measure 8. Is it okay to wait and see if testicular pain goes away? Not always. Mild pain from strain or temporary irritation might improve with rest, ice, and supportive wear. However, testicular torsion, hernia, or infection require urgent care. Never ignore testicular pain. If it appears suddenly, the testicle is tender or elevated, there's fever or chills, pain worsens over time, there's no improvement after 2 to 3 days. 9. Can tight underwear cause testicular pain? Yes. Tight underwear and pants can reduce airflow and increase temperature, cause compression of nerves or veins, worsen varicoceles or spermatic cord issues. Switching to loose, breathable, supportive underwear can often relieve mild discomfort. Not at our 10. Can you live a normal life after testicular surgery or losing a testicle? Absolutely. Many men go on to lead full, healthy lives after testicular surgery. Most can have children if one healthy testicle remains, maintain sexual function, replace the lost testicle with a cosmetic implant if desired, receive testosterone therapy if hormone levels drop. Psychological support and open conversations with partners are key to adjusting emotionally after surgery. 11. Is it normal to have one testicle hang lower than the other? Yes. For most men, one testicle, usually the left, hangs slightly lower. This is perfectly normal and not a sign of disease. However, sudden changes in position, shape, or size should be checked by a doctor. 12. Can testicular pain be caused by nerve damage? Yes. This is known as neuropathic testicular pain, often resulting from hernia surgery, vasectomy, spinal nerve compression, chronic inflammation. Nerve pain tends to be burning, tingling, or stabbing and may worsen with light touch. Treatment includes nerve pain medications, gabapentin, amitriptyline, nerve blocks, physical therapy. In rare cases, microsurgical nerve denervation. 13. Should I be worried if my child complains of testicular pain? Yes, testicular torsion is most common in boys aged 12 to 18, and any sudden pain should be treated as a medical emergency. Do not delay. Warning signs: child doubled over in pain, refuses to walk or stand, swelling in the scrotum, vomiting or crying in pain. Even younger children can experience torsion, hernia, or infection. Always consult a pediatrician or go to the ER for testicular pain in children. 14. What are red flags that mean I need emergency care? Go to the emergency room immediately if you experience sudden, intense testicular or groin pain, swelling or hardening of one testicle, high fever with scrotal redness, vomiting or fainting, visible trauma with bruising or bleeding, loss of sensation in the scrotum. Early treatment can save a testicle and prevent serious complications. Know your body, protect your health. Testicular pain is not just a minor inconvenience, it can signal serious underlying issues. The key is knowing your body, recognizing warning signs, and seeking help early. No symptom should be ignored out of fear or embarrassment. Remember, most causes of testicular pain are treatable. Testicular cancer has a high cure rate if caught early. You are never too young or too healthy to experience issues. Talking to a doctor is the smartest move, not a sign of weakness. Whether you're dealing with occasional discomfort or unexplained chronic pain, you're not alone, and there is help, support, and healing available.